Hey everyone, what's up? It's Dr. Charlie Johnson, physical therapist. Hope you are doing well. Do you need an x-ray or an MRI or an image to determine what is causing your pain, to show what needs to be fixed so that you can then treat it? The answer might just surprise you. I'm really passionate about answering this question because it's the number one barrier to getting better, all right? I just shot a Facebook Live on this, but wanted to share it here on my YouTube channel in hopes that it helps you out if you have the same question. Do you need an x-ray? Do you need an MRI? Do you need an image to determine what's going on so that you can treat it? Check it out. Do I need images to show what needs to be fixed? Let's dive into it. And oh, by the way, Dr. Charlie, if I send you my images, will that help you determine what to do? Very good questions, right? And as you'll learn here in a second, and as you'll see, and as you being a person in pain probably have recognized, that many people are very magnetized to this belief system, right? I get emails and messages every single day. And in fact, I just updated it about 5 minutes ago. That's why I'm starting 1 minute late, because I thought these are more good examples. They just flood in every single day. This is the stuff that keeps me up at night. All right. Shell says, hey, will this program work even if you have a torn hip labrum and spondylolisthesis? Again, very diagnostic centric. All right. Here's a guy I just chatted with who I know we can help. 100% certain we can help. There's zero question that he needs further MRIs and that, there's zero question that we can help. But he wants to go that way. So I've had multiple MRIs up to this point and is questioning whether or not his Tarlov cysts, the imaging, again, he's sort of bound. He's shackled and chained by the results of his imaging. All right. Are these Tarlov cysts the cause of my pain, right? I've got kind of this big one and then some smaller ones. By the way, showed on image one, however long later, it didn't change, it didn't grow. And then here are all the things that go against it. Just the logic of it. It doesn't even make any sense. And yet people still need to go on and they just need to quote unquote know, even though as you'll learn here in a moment, knowing doesn't actually do any good. All right. So would you agree? All right. And you can comment below with any questions or comments or concerns or whatever, but would you agree that if something was very clearly evident on the imaging, right, and doctors thought that it was the cause of your pain, that they should probably all agree upon, right, as experts in the field, if something's super clear and obvious, we're going to say, yep, that person has that. The sky is blue. It's blue. It's blue. It's blue. All right. If we can't all agree that the sky is blue, then maybe the sky isn't blue, right? So doctors cannot agree, despite his imaging findings, they cannot agree that this is the source of his symptom. He has some good days and bad days. So think about it. If your arthritis, if you can agree that this cyst probably does not change moment to moment, or the arthritis, right, doesn't change moment to moment. If I take a picture of your spine and I see a spondylolisthesis, right, or a hip labral tear, but you're saying, hey, the spondylolisthesis is like this to start, or the arthritis is this much to start, and then 5 minutes later it's the same, and then 5 minutes later it's the same, and within a day or within a few day time frame, we're probably not seeing massive changes where you have arthritis in the morning and arthritis is gone at night, and an arthritis in the morning and arthritis is gone at night. Tarlov cyst is there one moment, Tarlov cyst is not there, an hour later. That probably doesn't happen. These things don't change that quickly. They are there consistently, all right? But if you have symptoms, so the Tarlov cyst stays the same, the arthritis stays the same hour to hour, minute to minute, day to day, but the symptoms go up and down. And you can have good days and bad days. Despite the structure not changing, then your structure is not causing the symptoms. All right? Listen to that again. You can go back to it and watch. All right? Symptoms are delayed. If you have a broken bone, you feel it in the moment. If your Tarlov cyst is causing problems, it doesn't decide, well, I'm not going to hurt right now while we're moving around and bending and running and things like that, but later I'm going to hurt. It would hurt now and later. Right? Tarlov cyst does not change locations. Then why do your symptoms move around? If I have a bruise right here, it doesn't move to my other arm. It doesn't move. The pain doesn't move to my elbow. The bruise hurts and it hurts right here. Structural problems due to Tarlov cyst in this case, or arthritis or spondylolisthesis, they're not just randomly shifting around. I think we all can agree that stress does not change the size of a Tarlov cyst, a cyst in your spine. Stress does not change what your spondylolisthesis looks like or your hip labral tear. And so if your symptoms are worse with stress, guess what? Your structure isn't the problem. Because we know that stress does not change structure, at least in the immediate sense. All right? So it doesn't make any sense that structural finding would be the cause of symptoms. And I see this all the time. But this person decides to go get another MRI. Because they have to have a third one. Because the first one didn't see anything, the second one didn't see anything, maybe the third one. Why not the fifth one? Why not the 10th one? Why not the 20th one? At what point do we give up and stop chasing the diagnostic label? I'm suggesting you do it now. Okay? Just had 10:20 a.m. this morning, all right? Obviously, we offer to help people, and people set up chats with us to kind of review the case and make sure we can help. We have a little bit of a process there. We work with people all around the world. This person set up a call, and then they canceled it this morning, 10:20. Right? I have a repeat MRI. So again, this person puts off natural healing and or getting mentorship to really help them when they're in a tight space. But an MRI gets in the way, okay? And there are times, right, and we'll talk about this briefly, there are times when these images are useful, but it often just delays healing, right? It often delays healing. All right, so again, most people, including probably you, that's okay. This isn't your fault. This is just the way we've been sort of led to live and the things we've been led to believe are super glued to this way of thinking. Super glued to this way of thinking. And this stuff just absolutely breaks my heart, all right? But why? Because of what you've been told, because of what your mom said, because of what your dad says, because of what you do, because of what you've seen, because of what your friends say, because of what the world says, because of what media says, right? These are the scripts and stories we've been fed. It's all based off belief. That's it. It's belief. It's a construct, if you will, of the mind. It's an understanding that we have or we don't have, right, that leads us down this path of being glued to this diagnostic loophole, label. The belief is that images determine the cause of pain, which can then be treated. But as you'll learn in a moment, that is complete and utter nonsense. All right? This is Kyle here. He worked with us. This is a video will be on YouTube shortly. Just an amazing experience we had with Kyle, and of course his cat laying there on the bed. And tried everything: physical therapy, massages, stretches, exercises, chiropractic, pain meds. Was glued to pain meds. 7 MRIs. I'd like to highlight that. 7 MRIs. The first one didn't see him. Well, maybe they missed something. The second one, the third one, the fourth one. Some people need 7. Some people need 17. Some people are in it for 7 minutes and they're claustrophobic and they got to bang their arm against the wall and get out. All right. And so do you see how crazy this can get? That's how strong the belief system is. It sucked Kyle in, and he spent all of his time and energy and money. How much does it cost to work with you, Charlie? Way less than 7 MRIs. Very expensive pictures of the body don't tell us what we need to do. All right, and again, I can back this up. This isn't just me throwing it out there and getting all amped up for no reason. This is very well known. It's been well known for a long, long time. All right, so even when people are getting better, images suck people back into the system. This is a woman named Megan. She left me a Google review. And she had this pinched nerve. You can see this is her image. Okay, so she sent this to me via text. She took a picture of it and sent it over, and just did amazing. All right, fully back to dancing, doing everything she wants to do. Left this review, and then here's the interesting thing: after leaving this review, when she's back to full speed, she shoots me a text. Says, "Dr. Charlie, doctor says my disc is still badly herniated. He wants to do surgery. What do you think I should do?" What? You just wrote this, and you're doing amazing. It's almost like Men in Black. Like the memory was just zapped, right? And still, despite knowing all this information, you see this image, you're like, oh my gosh. Instead of leaning into how you're actually feeling, ask yourself, how am I feeling? I'm pain-free. I don't feel anything. Well, I see this. And so what do you think I should do? Do you think I should fix that? The surgeon wants to treat the image. They want to fix that thing. All right. Megan just wants to feel better. Megan feels better, but then is told by her surgeon that, well, your disc is still really herniated. But how do you feel, Megan? I feel pain-free. I feel great. Well, why would you recommend surgery? I can't tell you how many times people are headed in the right direction. I'm getting better, Charlie, but I'm getting an injection. Why are you getting an injection when you're headed in the right direction? Why would a surgeon even recommend that? All right? If you're heading in the right direction, why would you stop the positive trend and go backwards and get surgery? This is really your choice at the end of the day. I can't tell you how many people have images like this that heal naturally. But again, if this thing freaks you out enough, and then if you're in a vulnerable enough spot, then of course a surgeon may say, not all of them, right? A surgeon may say, hey, yeah, we need to fix that. Even if you're pain-free. How weird is that? Weirdest thing that happened to me, okay? Do I need images to show what needs to be fixed? We kind of just answered this, and we'll go dive more into it. By the way, if you have any questions about kind of what you're dealing with, your experiences with images, or if you have one set up, feel free to ask, and I'll do the best I can to answer. So the answer is no, you don't. All right. And Dr. Charlie, if I send you my images, will that help you determine what to do? And the answer is no, it won't. In majority of cases. Now, I'm sure there's a 1% case here, right? But we're speaking for the vast majority of people. They don't guide treatment decisions, at least for me as somebody who helps people use movement as well as mind as medicine, natural stuff, right? Here's why images are not needed to determine what needs to be fixed. So you think I'm not just a loony and I'm all excited about this stuff and I'm just speaking out my mouth and regurgitating stuff without any evidence or science to support it, right? Images cannot. So why are images not needed to determine what needs to be fixed? Because they cannot determine what's broken and needs to be fixed. And I say, why is he yelling? Because that's what I do sometimes. All right. Research continues to show that structural problems found on images have little to no correlation with pain, and that most common diagnoses or supposed causes for pain are completely normal. Are completely normal. All right. For example, and gosh, we could spend all day looking up studies. So you have to ask yourself, how much more do you want to see, right? To believe, right? MRI findings of joint deterioration are often interpreted as causes of pain, triggering costly medical treatments and surgery. For example, we know that people get MRIs, they undergo more expensive invasive surgeries than people who do not. They actually make people waste more money and time and energy and make people worse. But many of these MRI changes do not cause pain. They are instead a part of normal aging. They're like wrinkles on the skin, all right? If you agree that wrinkles on the skin are a normal part, and you should expect that when you get 35 and above, 45 and above, let's just say that, then you should also expect, just as a default, that your MRI will be abnormal and there will be wrinkles on the inside of the skin. There will be arthritis. There will be degeneration. That is not the exception. That is the norm. So maybe go into an MRI with that if you still don't believe me, right? Treat the patient, not the scan. Recognize that many so-called abnormal findings are just part of normal aging and don't need fixing. Discuss MRI findings with patients in the context of asymptomatic populations to minimize fear of damage. Fear. What is fear? Let's define fear right now. False evidence appearing real. False evidence appearing real. I'm giving you evidence such that it no longer has to appear real. It doesn't mean what they find on the MRIs is not real. It just means that for you, it may not be the real cause of pain. MRI, if this were a picture, right, of your spine, it's just a picture. It could be false evidence, right? If everybody has something wrong with their MRI, then is that really something wrong on your MRI? Or is it just normal because everybody has something wrong with them, right? And so tricky stuff here. This is a classic study and done in a big medical journal. 2015 is when it was published. 2014 it was written. British Medical Journal. Imaging findings of spinal degeneration. So this is for almost every type of musculoskeletal problem with the muscles, the skeletal system, so the vertebrae, the bones, the discs, the joints, things like that in the body. We see this for rotator cuff tears. Everybody has a rotator cuff tear. So you get an MRI, say, oh, I got this torn rotator cuff tear, I need surgery. No, you don't. All right. Again, when I say no, you don't, there are maybe some rare exceptions. Somebody with trauma, somebody with a fall, a fracture associated with that, right? But the vast majority of people do not. And the outcomes are essentially no better with surgery or not, right? So image findings of spine degeneration are present in high proportions of asymptomatic, meaning people have no pain, increase with age, just like wrinkles on the skin. Many imaging-based degenerative features are likely a part of normal aging and unassociated with pain. These image findings must be interpreted in context of the patient's clinical condition. How much time, put it down below in the comments, how much time when you went to the orthopedic surgeon did you spend chatting with them, sharing your story? What happened? What makes it feel better? What makes it feel worse? Why it started? How stress, how mood, how weather, how all these different things affect it. What things, is sleeping a problem? Does it matter how you sleep? Does it matter not? How many minutes? Give me a comment. It says when you met with an orthopedic surgeon, the last physician you met with, how much time did they spend with you asking about the history of this condition? That's a serious question. How much time? Give me some minutes. It's not good nor bad. I won't single you out, but I'm just looking for some times here because I know that when I worked at the University of Southern California pretty darn good, well respected. Hey, if you got a back problem, if you got this problem, probably some smart, very academic doctors there, which there are, right? I mean, Dr. Hatch saw 70 people a day. 70 people a day. I mean, just do the math. I mean, 5 minutes with somebody. He would rely on me doing the evaluation because he didn't have the time. And so oftentimes what happens is that how much time does someone spend asking you questions? Maybe 10 minutes, tops. Yeah. And by the way, how much time do they spend then if there's three things that go into understanding what we need to do to fix you or to help you fix yourself? Let me say that better, right? Story, your story. All right. So again, what makes you feel better? What makes you feel worse? How long you've been dealing with this? Anything else that's going on in your life when this happened? Stress, no stress, work, all this stuff, right? Story, location of symptoms. That's pretty obvious, right? But then a movement exam. And you could say imaging is like maybe the fourth thing. Movement exam. How much time did they spend going through a movement exam with you when you were there? So in 10 minutes, I've got to collect this person's story. I've got to do a full-on movement exam. And then I've got to look at these imaging, right? And I've got to determine if this person needs pills, shots, or surgery. Not the job I want, right? And so yeah, I hear you. And so look, I'm not saying that surgeons are bad people, okay? I'm not saying that all surgeons, maybe there's some surgeons, I'm sure there's some surgeons that take 45 minutes, an hour, right? Call people after work, right? Just like I do. And so it's not a good nor bad debate. It's just to say that, look, context, there needs to be context for this image, because guess who's looking at your image results and writing the report about what's wrong, quote unquote, what's wrong with you? The radiologist, who you don't even meet with. The radiologist is a third-party person. They don't know anything about what you're dealing with, right? So we see this with almost every diagnosis. No correlation between lumbar spinal canal stenosis found on MRI with symptoms or how well you can walk or not walk. No relation between MRI findings and the symptoms of walking capacity were found. Again, no correlation found between lumbar spine degeneration and pain. They're frequent on the MRI. They're always found, right? Because, I mean, everybody after a certain age has wrinkles on the skin, right? Wrinkles inside the spine, but do not correlate with the intensity of pain and do not predict whether or not you're going to have nerve symptoms in this case. This just happened 14 hours ago, and I woke up to it. I recently got a hip MRI. This is somebody actually inside my glute relief accelerator program. I was told by the doc I have a small labral tear in my left hip. You'll see what the stats are there. I then asked how it correlated with my glute and sciatica pain. The doc told me that if there is instability in the hip, then the piriformis and other muscles in the hip will tighten and overcompensate and try to stabilize the hip, causing pain. That's BS. I'm sorry for saying that. That's baloney. There are people out there with one leg who are clearly compensating and hopping around. There's dogs out there with 3 legs, and they're not crying in pain. And so if somebody can have one leg and not feel symptoms, even though they're compensating, and you have just one of those people in the world, then it doesn't mean that it always has to be a problem, right? I'm right-handed and I do stuff with my right arm all day. Does that mean I have to live a life with pain because I'm overcompensating constantly because I use my right arm for everything? And so you see how this doc gives a very laissez-faire answer. Overcompensation, it's the cause of every pain out there when we don't actually know what's causing someone's pain. We give lazy answers, and then people like you suffer. Instead of, can you prove that my hip is tight and overcompensating? Well, how would we even measure that? We can't, because there's lots of people that overcompensate, quote unquote, whatever that is, right? And they don't hurt. If I take my right arm and I reach up behind my back, this is all I can go. But on my left one, I can go here. Am I overcompensating and tight on my right arm? Well, of course. I guess so. Maybe. Do I have any pain? I don't have any pain. Should I have pain? Well, guess what? If I go and I start to feel pain in my right shoulder, of course, they're going to say, well, you're tight and we need to fix it. If you ask, you shall receive. If you seek, you shall find. If you go to somewhere and someone and you ask them and you pay them lots of money to take a picture of you and say, why do I hurt? They're going to give you some answer most of the time. The truthful ones will say, we don't know why. And this labral tear could have been there for years. But instead, false evidence appearing real, and even more appearing real now, because some smart doc told him this. And they've got to be smarter than Charlie, right? Study of 11 pro rugby players, 10 pro ballet dancers, 10 medical students. All very young. Look at this, 19 to 28. Look, they put medical students in there. Rugby players, ballet dancers, medical students. We just sit and study all day. I studied for 16 hours a day, every day for years. Without any pain or symptoms, had their hips scanned and found. 90% of rugby players, no pain, labral tears. Ballet dancers, 90. Medical students who do nothing. They do nothing except study. And they do walk from, room to room. They get lots of walking in there. Torn labrums. Well, guess what? They didn't have pain before. I wonder now how many of them after the MRI have pain. Probably 90% of them. Okay. How many people have bony abnormalities in the hip? Look at this. It's red. That's a problem, right? It's scary, isn't it? Look, Cam. Oh, it's bumpy there. You have some overgrowth on this part of the hip socket or on this part of the ball of the socket. Or you have them both. Oh my gosh, it's death. Everybody, meaning the majority of people, medical students included, ballet dancers, we all got them. Bone edema. There's swelling in my bone. Must be something wrong. Maybe, but maybe not. 40% of medical students, probably because they study bone edema, have it. Ballet dancers, rugby players, they still got it. This was sent in last week and a half ago. This was a gentleman who reached out to me. Thought I was suffering from sciatica, pain in the right buttock, muscle weakness in the right leg, pain in the upper thigh, numbness from the knee to the ankle in the front of the shin, ankle pain, skin sensitivity. I've had many tests. Results are inconclusive. Here's the MRI. L5S1, severe decreased disc height. There was a broad left. Where are his symptoms? On the right. Disc protrusion. Compressing the left S1 nerve root. The right seems fine. All of his symptoms are on the right. Left-sided disc protrusion, impingement of the S1 nerve root on the left. However, this is opposite of the side of the clinical concern. It's out of context. The patient indicates only right leg symptoms on the spine MRI. No right-sided nerve problems are found. His right side of his spine looks fine. But his left side of his spine looks screwed up. He has no symptoms on that side. And so isn't it interesting that if this person went and said, all my symptoms are on the left side, oh my gosh, it totally makes sense. Charlie, look at this. You can't help me. How are you going to help me unpinch my nerve? Your nerves can be pinched and cause no pain. And this person will be getting surgery if his symptoms had been on the left side, because the MRI would make sense in that case. But because his symptoms are on the right side, doctors are scratching their head saying, MRI findings don't make sense in this case. So how then, at the end of the day, how the heck do we distinguish between MRI findings that make sense or don't make sense when stuff like this happens? We close our eyes, eeny, meeny, miny, mo. We're going to do surgery on you for this disc problem, but for you, it's actually a normal finding and it's not causing pain. Scary stuff. At least for me. Scary stuff. Okay. If all these abnormal findings and things wrong have been proven to not cause pain in many cases, then how does an image help us distinguish what needs to be fixed? And it doesn't. Context. When you look at this picture, what do you see? Everyone knows this picture. Most people do. Okay. Do you see the old lady? See the old lady, the big nose, right? The lips right there, her chin right there. She's kind of got her head inside of this, I don't know, scarf or something like that with a little feather on her hat. Or do you see the young lady whose face is looking away from you? Right? There's the tip of her nose. There's her eyelash. Do you see it? There's her ear. All right. What do you see when you look at this? I see an apple core. But if I look at it again, I could say, look at the negative space. I could see a person over here and a person over here. Which is it? Who's right? What I want you to do if you're watching this right now, what's going through this girl's mind? Give me a story. Paint me a story. Give me like a few words. Is this girl happy? Is she sad? She's playing Legos? Is she being creative? Is she down in the dumps? Is she getting ready for a birthday party? Is it Easter and that's why she's got all those colorful Legos? She's getting ready for Easter. She celebrates Easter. We don't know. All right. Because a picture is just a picture. There is no context behind the picture. This girl could be having the worst day of her life. And you might think she has the best day of her life. This girl may hate Easter. This girl may be super sad. Maybe somebody in her family just passed away, or her grandma's no longer here. Someone got sick. Maybe her rabbit died. I don't know. And do you see how silly it is to try to guess what's going on with this picture without any context? And yet the physician spends 10 flipping minutes with you. Let's look at a picture without context. Let's have someone describe what's going on in the picture, the radiologist, without any context and ever chatting with you and listening to your story. And then let's base surgeries and treatment decisions around it. Let's see how well the stuff comes out. Good luck. You've probably got a better chance of winning the lottery. Without context or a story connected to a picture, the meaning behind it is useless. It's all up for interpretation. Images are just pictures. Interesting how when you go to the doctor and they recommend an MRI, most people do not put up a fight and say, oh, no, I don't know about that. They just hand over their $1,000 or whatever their deductible is to get a picture of the spine, only to find that it makes them worse. And it doesn't actually solve the problem. I just got off a phone with a woman today. I chatted with her for 45 minutes. MRI shows this. We've got to fix it. Failed back surgery. Treat the image. You might have a pretty picture, but it doesn't mean you're going to feel better. And by the way, everybody has an ugly picture. The most expensive selfie money could ever buy. An X-ray or an MRI. 63-year-old woman, super curious, kind of like me, probably gets herself in trouble. All right, back, butt, and leg pain. She's a nurse, very inquisitive, my kind of gal. 10 MRIs at a local spine surgery center, by the way, right around the corner from me. All right, Southeastern PA. 10 different places. 10 MRIs, 10 different places, all within a 3-week time frame. Here's what she got. She has back, butt, leg pain. 10 different diagnoses. If you don't believe me, look it up. In the Spine Journal, 2017. Variability in diagnostic error rates of 10 MRI centers performing low back MRI exams on the same patient. What does this tell you? You cannot trust these things. I don't know how they become so trustworthy. Somebody like myself, you search far and wide for one bad review. It's like, he's untrustworthy. He's online. This is a picture. And we trust it more than anything else. We hold it as the thing, which holds the truth, our diagnosis, and then we base our treatment off of a picture, not off of what we feel. Okay? Therefore, images are not needed to show what's wrong or what needs to be fixed. They can't. Okay? So if everyone has something wrong, then does everyone need to be fixed? Just some questions to consider. Are we striving for an MRI that looks good so that we can be normal? Or would that make us abnormal? Having a normal MRI, one that looks good, again, would be the exception. Because all of us are abnormal. Ouch potato, I just like that name. This is interesting too. There's like a reverse psychology effect here. I've had multiple MRIs and X-rays that don't show much damage. The doctor ends up seeing an image of what looks like a healthy human, but I'm bedridden from pain. And people like this get angry too. Maybe you felt like this. Why? Because we just want to justify what we're feeling. We're humans. We're emotional creatures. We don't want to feel like we're crazy. I'm in all this pain. I don't want to see something on my MRI. I hope everything's okay. And that would make me feel better, Charlie. But then when the MRI comes back and it looks good, now I'm even more angry. And so you're darned if you do, you're darned if you don't. We're putting all of our weight on this picture. Take the picture and do this. Get rid of it. You're not your picture. It's gone. I hope I didn't need that. Or maybe none of this stuff really matters and you just want to feel normal and you just want to feel better and get back to your normal, whatever that means. Abnormal imaging findings aren't abnormal, okay? And side note, look, it also means that if you are having your body analyzed under like this microscope, if you will, that slices your body into all these different layers and looks at all the possibilities and if that can't determine the source of your pain, then someone's ability to put their hands on you, feel what's out of place or what's wrong with you and causing your pain is absolutely impossible. And you must agree with me there. And if you don't, that's okay. But hopefully you can tell I'm super logical. If somebody taking a microscope to your body, if that thing, all the technology and all the money and all the research invested in trying to, highlight what's wrong with people at a microscopic level, peeling away the skin in all the layers, cannot determine what's causing your pain, then you can't go to your chiropractor or to Charlie or someone else and say, oh, your leg's a little bit longer than the other. That's what's going on. Crazy sauce. And I don't say this to make you feel crazy if you've gone down that path. I'm trying to say this and with a lot of conviction and confidence and oomph because I don't want you going down that path. Right? Now, I say all this because then I get the backlash. Oh, you think I had, Charlie, I had an x-ray and it found a tumor. I had an x-ray and found a fracture. And had I not done that for years, somebody would have missed it. If you're not improving, it's always fine to go get an image. Okay. If you're not getting better, as long as the treatment was systematic, this does not mean that that they have no use. But contrary to what you've been led to believe or told, the purpose of imaging is to rule out big, ugly, and scary things, tumors, fractures, infections. And there are signs with that. Age greater than 50, previous history of cancer, unexplained weight loss, failure of conservative treatment. You got all four of those? Go get an image for a tumor. Your age greater than 70, you have a previous history of smoking, you've taken corticosteroids or had multiple injections into your spine. By the way, if you're postmenopausal, especially a female, can happen in males too, getting multiple spinal injections or injections in your hip will weaken bone. It will accelerate bone loss. It's just a shot. It's a quick fix. No, it's making your bones brittle and jacking your blood sugar up also. Age greater than 70, previous history of cancer, smoking, trauma, I fell, I lifted something really heavy, I felt something in the moment, steroid use. Go get an image for a fracture. All of these things have signs, but because people don't listen to the story, and because they don't screen for them, because they just don't have time, and we just want to be lazy and rely on this image, which I've torn up, it's the easy way out. Images are not meant to rule in natural occurrences like disc issues, arthritis, or muscle strains, or little tears here or there. You should have those things. If you don't, something's wrong. Something's wrong if you don't have them. And luckily, when you look at the statistics, we're talking 0.5 to 1% of folks presenting to someone with back, butt, or leg pain, presenting to myself, presenting to a primary care doc. Meaning for every 100 people, there's maybe one max, statistically, that will have something sinister, serious, life-threatening causing their pain. So that means that 99 to 99.5% of people going down to get an MRI right now to make sure nothing's wrong actually have nothing abnormal wrong at all. Right? So every 100 people who get an MRI, the vast majority, maybe it's not 95, 99%, but the very large majority of them didn't need it at all. Because statistically speaking, these things don't occur in high probabilities. And there are signs of them, by the way, which lead us to that stuff. Dr. Charlie, if I send you my images, will that help you determine what to do? Now I know what's wrong with me. We can treat it. No. We could have spent all that time and that money and that energy that you took waiting for the MRI, doing this, doing that, and you could have been better by now. You could have been on your way. Look, if we've proven that pain has little to no correlation to physical damage and diagnostic tests are unable to accurately determine the cause of pain, then there's no possible way that the results of your image, your diagnosis, could lead to reliable treatment recommendations. If the picture is not accurate, if you have instructions that are not accurate, you can't trust them, There's no way it can lead to your accurate ability to put something together. Diagnosis doesn't equal treatment. Images don't tell you what's wrong so that you can treat it. That is, of course, unless you enjoy chasing many possible random issues that you're told are wrong with you and treatments in hope of finding relief. That's just not what I would consider very efficient. And I think you would agree with that. Mary, this is the point. The first point to eliminating pain, you said, please get to the point. How can people eliminate pain? Cut this out because this increases the fear. So the first step is not to chase the diagnosis. We can talk about the process to eliminate pain, but I can't share with you, Mary, right now on this, how to eliminate your pain because I know nothing about it. Okay? So don't take that the wrong way. But the point is, at the end of the day, people would say, well, just tell me how to become pain-free. As if it's like this magical thing. It's not. There's a process to it. The process is you have to optimize the healing environment mentally and physically, and you have to do work there. Right? If you're doing things that constantly pick the scab, Mary, and you're not aware of it because you just don't know what you don't know, which makes sense, right? You wouldn't probably know this or you wouldn't be here. Then you're not going to improve. Second step, you have to measure things, right? You have to measure certain movements and activities week to week. You can't manage what you don't measure. You can't build a house without a tape measure, right? So that you can tell if what you're doing is working. The next thing is you need to come up with a process for testing to find one motion or one thing you need to do. Most people think that to get out of pain, they need to do more. Well, I'll do a sheet of exercises in hopes that it works. Good luck. That's like saying, hey, I'll throw a bunch of random ingredients that I'll find inside my pantry into a bowl. I'll stir it together and hope that a cake comes out of it. Not going to work. And so then you've got to, like, it's not as easy as, hey, there's a process, right? But you've got to work with somebody who specializes in the area and has a process for teaching you how to do this. Reduce fear, reduce worry, reduce concern, break beliefs. This is one of them, right? Because I'll tell you how not to get out of pain. Believe that you're broken and believe that you can't get out of pain because you're limited by your diagnosis, right? Second thing, optimize the healing environment. Identify what things are making you feel better. Identify what things are making you feel worse. And you've got to change things there because you can't just keep nicking the scab and expect that you're going to get better. You need to measure what's happening systematically along the way so you can tell actually what's working. You can't manage what you don't measure. Pretty basic analogy. I think that makes sense, right? And then you've got to identify when it comes to motion, how do you know what the one motion is to do? And there's 118 different options I've found. This is why I coach people, right? But the idea is you've got to start testing to find motions that work. And there's a process for doing so you're not just randomly trying things, right? So if I skipped this, I would do you a disservice, right? Because if you're still stuck here, then there is no ability to help you. All right. Hopefully it makes sense, Mary, okay? In simple terms, if you're looking for natural relief, diagnosis is a dead end, all right? And Mary, look, if you want me to review your case, all right, there's no charge to review the case. If you want me to review your case personally, all right, I am happy to do it. You can literally just put case review below, Mary. We'll reach out to you. You can set up a time to chat. We'll review your case. If I don't feel I can help, then I'm just going to give you a personal call and say, hey, I don't feel I can help. All right, so hopefully that's fair. I did that actually the other day to someone. Said, hey, I really think that you're going to need a new hip. And so we'll just tell you if we can't help. All right. So case review would be the best way to see even if we can help because your pain can be caused by many things. And I just don't feel good providing a blanket recommendation other than sharing a process with you, without more details. Okay. Hopefully, again, that sounds fair. So put case review below. Okay. So let's assume for one moment that if it were possible to get a clear and accurate diagnosis, which led to reliable treatment, how would this change things? Okay, let's assume that this image is accurate all the time. The instructions are always the same and they're always accurate. That would be super valuable for you if you wanted surgery to fix the structural problem. Right? If you want to heal naturally, mind and movement is medicine, holding on to this way of thinking doesn't serve you. And for two reasons. Number one, if I said to you, hey, you've got a disc problem, and you know what, this is always accurate. There isn't anyone out there, every time someone has a disc problem, they always hurt. There isn't anybody out there who has no pain and has a disc problem. You have a disc problem. It's right here. Do you see it? Yep, I got it. Okay, you want to solve it naturally. No problem, Mary. You want to solve it naturally. And thank you for your question. I know I get amped up. Okay, thanks, Mary. All right. Go ahead, if you want to solve this naturally using movement. go ahead and wiggle your disc and only your disc. So let's go ahead. Let's do it together. Can anybody wiggle the disc and only the disc? Go ahead. We're going to do the number one exercise for disc herniations. Do this. Oh, don't move your belly. Don't move your shoulders. Don't move your neck. Don't move. Don't move. Just your disc. Just move your disc. And you might think, this guy's crazy. That's impossible. I can't just move my disc. I got to move my arms. I got to move other things. I got to stretch my hips. I got to lengthen some nerves. I got to move my eyeballs. My belly button shifts a little bit. If you agree that you cannot wiggle your disc and only your disc, you must also agree that exercises for a specific diagnosis do not or cannot exist. Now I'm standing. Now you know I'm getting serious. All right. SI joint exercises. Just tell me what to do. Herniated disc. I have a disc problem. Just tell me what to do. Move your disc and only your disc. You can't. And so if you cannot move that one thing, then realize that movement occurs or the body moves in patterns. And then by moving one thing, you're also moving many other things. That exercise I just did on the ground is going to wiggle my disc and compress my joints. So is it an exercise for a disc problem or for a joint problem? Or both? Should we do this? Should we not do this? These are all beliefs that need to be broken. If you believe that you have spinal stenosis and that's the cause of your pain, guess what? You're going to be like, I shouldn't bend backwards. That's bad for me. What if that would help you out? Movement is non-specific, folks. The second reason, if you remain tethered to the belief that your pain is due to something found on your x-ray or MRI, even if it actually is, you're in trouble. We can't change it. All right, we can't change it. You'll forever be defined by your diagnosis and what you have wrong with you because there's no way you can fix your arthritis. It's out there. It's on this thing. Fix it. What are you going to do? Take a Sharpie marker, right, or erase it? You can't. It's here. False evidence appears very real. And it is very real. You have it, but is it the cause of your pain? Why? Again, it's outside of you. You don't have control of it. Because you don't have control of it, right? You're not able to resolve it. And only a surgeon can physically change that arthritis. Dr. Charlie, how are you going to help me? I have arthritis. You can't go in there and change it. Do you want me to? I mean, everybody has arthritis. So if you believe that that thing is causing your pain, then a lot of people say, well, how can you help me? Because, Charlie, you are a PT and you can't change that. Then you're right. I can't help you. Only the surgeon can, because only they can go in there. All I'm asking is that you ask yourself, what if that which I've been told to be true or the cause or is the cause of my pain isn't really true? It's a normal thing. Wouldn't that be weird? This might make you scratch your head. It might make you a little angry, in which case it might cause a change. Quick case study to prove my point. A gentleman who is diagnosed with spinal stenosis has been suffering for 2 years, 80% better in 4 weeks after working together. You'd say that's pretty good, right? But he just couldn't get past it. Even though none of it made sense, he couldn't get past his diagnosis. His picture was just locked in his head. Dr. Charlie, I don't think this stenosis thing will be 100% fixed with inner buttock issues and pain down the back of my thighs and the knee. I will say, though, I'm much better overall. Quality of life is about 80%. I'm 80% comfortable all the time. Thanks for reaching out. Best wishes. Okay. Now, 80% is pretty good, especially after just 4 weeks. But did you notice what's holding him back? I don't think this stenosis thing will be fixed. Let's stop thinking and let's start looking at logic and clues. Now, of course, this X-ray and MRI showed stenosis because everybody has it, along with some disc issues and some other problems. But his logic is really flawed here. And because of his inability to escape the old diagnostic paradigm, for example, Mary, this is why I'm presenting on this topic again. And I will in a few more months, because it doesn't matter how much we say this. People have a really hard time grasping it, and I get it. It's not your fault. But right after this, you're going to talk to your friend who says, hey, did you get an MRI? Oh, gosh. Nightmare for me. So what he thinks will keep him from getting better. Because he thinks he can't get 100% do his diagnosis, he won't. Sadly, every day. Now, here's the nutty thing. Do you think that the motions we found, which reduced his pain by 80% in 4 weeks, eliminated the arthritis and stenosis in his back? Yes or no? Do you think that the exercise that we did erased the stenosis, resurfaced his bone and his cartilage, and made it all smooth again? Yes or no? Linda, you're sharp. After listening to you, I worked on managing my fears and movements. I got back to being pain-free daily. You're crushing it, Linda. Did the movements that we did change his arthritis? Of course not. So if his image today, and I alluded to this earlier, shows the same arthritis and stenosis as it did 4 weeks prior, but he's now 80%, was the stenosis the cause of his pain? It didn't change, but he got 80%. Was the stenosis the cause of his pain? Absolutely not. No way. And we didn't change a thing. I didn't go in there and do anything to his back. There's another element at play here. Two things happened and can happen to you. This diagnostic paradigm, this old way of being like, yep, I hurt. Yep, images, that's what I do. I go there, they tell me what's wrong, and because of that, well, now I need to do X, Y, and Z. They held him back and prevented him from thinking outside the box. They flawed his logic. They put a mask over his face. They blurred his goggles, if you will. And the idea is whether you think you can or you can't, you're right. You become what you think about. Your diagnostic label here, slap it right now. If you've got a labral tear, if you've got spondylolisthesis, if you've got arthritis, if you've got a herniated disc, if you've got an extruded disc, if you've got an SI joint problem, if you've got piriformis syndrome, if you've got quadratus lumborum issues, if you've got glute med problems, if you've got facet joint issues, if you've got disc degeneration, if doctors have no idea what you're dealing with, you have 100 labels, throw them all in this box. These are all the things you shouldn't do because of that label. These are all the things you should do. What a way to box ourselves in, okay? Let's break free of that box. The second thing that happened was this. Since the moment he saw and heard his diagnosis, you may resonate with this, he's been unable to unsee and unhear it. He believes so strongly it's out of his control and he'll be unable to change it. He starts to catastrophize. Oh my gosh, I have this thing. What do I do? You're going on Google. You're going on YouTube. Heck, this is how you're probably here, searching for to figure out the cause of things. And people can't let it go. Even if they say, oh, I know my MRI doesn't tell me anything, but I still need to get it. Well, then they don't really know, right? They say that, but they don't really believe it subconsciously. So his beliefs and ways of thinking literally boxed him in, all right? And the research is so strong, okay? Appropriate use of diagnostic imaging in low back pain. Unnecessary imaging. Remember, 1% of people have something big, ugly, scary. So out of 100 people, 1 person might have something big, ugly, scary. 99 others don't. And yet, I don't know how many out of 100 walking down the street, I could ask maybe, they'd probably kick me out. How many people walk in here with back pain, get an image? I guarantee it's more than 1%. So let's say the majority of people get some X-ray or MRI. Unnecessary. The rate of MRIs in the image, or in the US, is growing at an alarming rate, despite evidence that is not accompanied by improved patient outcomes. Here in the US, we got all this technology, and we hurt more than anybody. Overutilization of imaging and individual back pain correlates with a 2 to 3-fold increase in surgical rates over the 10 years. Dr. Charlie, I don't want surgery, but I need to see my MRI. You're asking for it. Furthermore, a patient's knowledge of imaging abnormalities can actually decrease self-perception of health and may lead to fear avoidance and catastrophizing behaviors, which cause chronic pain. Fear. The association between early MRI and length of disability and acute low back pain. Those who received MRIs experience a longer period of disability compared to those who did not. I'm not making this up. This is very clear. We've known this for years. It's in the guidelines. Don't order MRIs and X-rays for people with back pain unless you suspect one of those 3 things. And guess what's the first thing we do? Let's order an X-ray or MRI. And it's not because those who had an MRI versus those who didn't had a major difference in diagnosis. All kinds of showed up for both people because everybody has stuff, quote unquote, wrong with them. But because of the mental chatter and limiting beliefs that the image stamped on their subconsciousness, that's what happened. That's why those people hurt more for longer. You can't turn back time and unsee or unhear what you've been told, but you do have control over the future and power to control your way of thinking moving forward. If you focus on that which you have no control over, you feel out of control. Surprise. You need to focus on what you can control. Mind, body. This is what you can control. These are the levers. What can I do to get out of pain? Learn how to move your body in a way that feels safe. Learn how to get your headspace and mind in a place that feels safe instead of being riddled with fears, worries, and concerns and catastrophizing about the results of your image. Take that energy and put it elsewhere. Treat your pain experience, which is created by mind and body. Treat one, you're going to miss the other. Treat both, chances are you'll have the best outcome. Caleb, member of private coaching program. Pain in both glutes and hamstrings, constant numbness in the foot since 2018. It was 5 years ago, 6 years ago. He believes running marathons causes pain. In 2021, started to see medical help. He couldn't ignore it. First MRI, retrolisthesis. Here we go. He's going to get sucked hard down the rabbit hole. And unfortunately, I just watch it happen every day. And I can't do anything except for educate people. No back pain. First steroid injection. Oh, there's a problem on your spine. Let's treat it. Treat the image, not treating Caleb as a person. I continue to seek answers in early 2020. More imaging, more x-rays. I just heard a story the other day. This is bad, all right? I went to a chiropractor who offered free x-rays. That should be malpractice. All right? Free radiation that's going to make you feel worse. You didn't have a headache when you came to me, but I'll give you this free radiation, and afterwards, you'll probably have a headache because I'll tell you all the things that are broken within you. More x-rays, more MRIs. No SI joint changes. Pain management, read my films. Convinced now, since the injection didn't work, there's a problem with the SI joint. I'm going to shoot it in the right one and the left side because we're just clueless and we have no idea. Let's put steroids in an otherwise healthy young male who's a runner, by the way, and is loading his bones 2.5 times force through his joints in his lower spine and hips and knees when he's running. Let's put some steroids around those puppies so we can weaken the bones if we're not careful. Different opinions, a whole slew of more images and testings. Paralabral cyst, labral tear, tendinosis of the hamstring, pubic symphysis, degenerative changes, stress reaction or stress fractures of the pubic symphysis, etc. Repeat SI joint x-rays again, no abnormalities of the SI joint. Extension flexion x-rays, more radiation, slight disc space narrowing. PT, University of Virginia, he's good, okay? Who is concerned for upper motor neuron problems. They check for MS, cervical spine, T-spine, disc protrusion. Now he's got problems in his neck, nerve tests, surgery to his glutes, steroid injections, dry needling. This is crazy. This is his review. He's back to running marathons. Today I ran a marathon in the mountains for the first time in over a year and a half. He taught me how to reprocess pain, fear, anxiety, benefit not just my physical, spiritual. I'm so grateful we crossed paths. None of that stuff was causing any of his problems. A classic example of what treating an image looks like. Eric, 5 months. I was working with the aluminum industry on vacation and started aching. MRIs. Here's the downfall of Eric. They start with an image, L4, L5, L5S1. The bulge is healed. L5 is a protrusion. X-ray, CT, MRI, protrusion. Dude is doing it. When I first started, I couldn't sit for 20 minutes without back pain, shooting jolts, aching beyond anything I've ever experienced, and pain going into extension or back bending, sleeping no more than 5 hours. I was scared to work. 7, 8 weeks in the program, working again. I drive an hour and a half every weekend to visit family. I made 2-hour ventures to Cleveland, Allegheny Forest. Sometimes absolutely no discomfort whatsoever. While I'm not 100% there yet, I truly believe I will. I do occasionally have muscle twitches along with some funky sensations. I basically 0 symptoms for 3 days, and that's a win worth shedding tears of joy. This guy was sleeping or laying down in the side or in the bed of his truck at lunch because his symptoms were so bad. I couldn't have accomplished this without the help of our team. Meet Jim. This guy was set up for an SI joint fusion with occasional flare-ups, okay, because he had pain in his right SI joint for 2 years. Cleveland Clinic. They're good, Charlie. They tried to align his pelvis. Went to PT, chiropractic manipulation, an OT, chilling the nervous system, trigger point, acupuncture, steroid injections, and everything because let's treat the image, not Jim. Rejected surgery because they were going to pin his SI joint. The dude's fishing. He's good. I just got an email from the other day. Still good. Thanks. He said I can come to his farm and go hunting with him in Ohio. So I'm going to hold him to that. All right. No pain. Fishing trip. He hasn't done for years. No pain. And then you've got this person who I couldn't save because they were too glued to this. Never ended up working with them. I'm scheduled to get an SI joint fusion, but I'm not sure if that's where my pain is coming from. I also have joint arthritis. Most of the pain is in the hips and glutes. Very little sciatica, numbness in my feet. Pain gets worse. On to surgery. How will the results of your image alter the treatment of choice? If you say, hey, it's not, why do it? All right, so there you have it. Perhaps a little bit raw, a little bit wild, a little bit over the top for some people, but if you have back, butt, or sciatic problem, what I just shared is the truth based off the most available and sort of latest up-to-date research, is that a lot of these images, x-rays, MRIs, other tests, they actually make people worse. We know that that's not the intent, but they freak people out, and they often discover very normal findings, which people turn into things that we need to attack with treatment, right? And so again, we know that these things lead to more invasive tests and measures than if you do not get these things, all right? So doesn't mean that they're never useful, just means you've got to be careful there. If you're watching this, you're being pressured by family and friends to get an x-ray, get an MRI, but you're like, I really don't want to go down the path of pills, shots, or surgery. I want to learn how to resolve this naturally. And you would like some mentorship, you would like some guidance, go ahead, click the link below, somewhere in the pinned comments or the description. We work with people all around the world with back, butt, and sciatic problems. I would love nothing more than to review your case personally. So click the link below. It'll take you to a schedule page. Select a time to chat with us. Beyond that, follow instructions to submit a formal case review. I will review your case personally. If I don't feel I can help for whatever reason, I will just reach out personally and let you know. So if you're looking for some help, click that link below. Thanks so much.